Hi, this is Dr. Scott Jensen, and I'm just going to let people grab on to this live Facebook stream over the next few seconds. But I want to talk today about waste, fraud, and abuse. I want to talk about what does a racket look like? And I'm not talking about a good kind of racket. I'm not talking about a tennis racket. We need to have a conversation, and I think that I would say this. You may not like what I'm talking about, but I would rather be guilty of trying to expose truth and potentially getting in trouble for doing that than to, if you will, remain silent. So I think perhaps everybody's had a chance to get warmed up to this Facebook live stream. But what I'm going to talk today is I'm going to talk about testing. I'm going to talk about COVID testing. When I was in the Senate, I was chair of the Healthcare Access and Affordability Committee. It was a special Senate committee that was created, and I was asked to chair it. And we talked about low-value services. This is really important, and I think today in the American Journal of Medicine, a physician wrote an opinion, and his name is Alan Cohen. He's a doctor. He's retired. He's from Eugene, Oregon, and I don't know him from Adam. But this is what he said. The title of it was Concerns About Our Public Medical Response to COVID-19. And he says this. He's describing himself. I'm a retired primary care physician with experience in teaching, management, and research. I've been surprised and somewhat disturbed by what seemed to me to be obvious missteps, but I've been hesitant to go on record. I am not going to be hesitant to go on record. However, he goes on, as the policies endorsed have so far proven to have less than ideal results, I think it worthwhile to make a few observations about issues which seem not to have been given sufficient attention to date. He goes on and says this. It has been amply demonstrated that drug companies influence the research agenda and that studies funded by drug companies tend to magnify positive outcomes concerning a company's products. Unfortunately, nearly all the studies that have established the effectiveness and safety of the 3 vaccines approved in the United States were funded by the companies that profit from their sale. He went on and said this, it is disconcerting to find that after 2 years of use, we still do not have reliable evidence that the mRNA vaccines have saved a single life. Clearly, the vaccines have prevented disease, hospitalization, and visits to emergency departments, and they are extremely likely to have decreased mortality as well. But although we have endless studies of the relative value of various tests and diagnosis, we have none that are definitive about mortality. Now, please remember, this is a physician who spent much of his career in teaching, management, and research. This is a fellow I've never met, Alan Cohen, a doctor in Oregon. Then he goes on and says this, finally, science is best served by open communication. The interpretation of studies benefits from a full range of opinions. He says, many people, some of whom have developed, supported, promoted, or lobbied for vaccinations all their lives, have been hesitant about the COVID mRNA vaccines, though some of them have been, until recently, respected practitioners, teachers, and researchers. Their opinions have often gotten them removed from social media sites, and many of them say that they had difficulty publishing, having been undermined or been threatened with loss of job or license. And then he closes with a statement like this. He says, nonetheless, the failure to adhere to what seem to be routine principles of sound scientific inquiry and intervention have, I believe, harmed the reputation of organized medicine and public health and diminished the likelihood that the pandemic would come under control. This is an article in the American Journal of Medicine, Volume 135, Number 7, July 2022. I think this is really important because today in NPR, the Minnesota Public Radio News, there was an article entitled, actually it was yesterday morning, I guess at 5 a.m. It says, Private COVID Lab Created Headaches for Minnesota Consumers and Health Officials. This is very important. I'm just going to start at the top. As COVID-19 surged during last year's December holidays, that would be December of 2021, a private testing company delivered some troubling news to officials at the Minnesota Department of Health. It had a backlog of nearly 28,000 tests. So the Minnesota Department of Health was advised that 28,000 tests had not been run yet. This is a company called GS Labs out of Nebraska, and it had been behind for weeks as the cases of COVID's Omicron variant leaped. Among those delayed results, nearly 2,400 were positive. So 28,000 backlog tests, almost 10% of them were positive. That included nearly 1,400 tests from people who may not have known that they were carrying the virus. You can imagine how difficult it is for the Department of Health, patients, physicians, healthcare workers to help try to stop this spread. Then they say this, NPR, questionable, slight left-leaning news source, perhaps. The problem was no one-off. The company struggled to submit COVID test results even as the company allegedly pushed its regional sites to get customers to test more in order to maximize insurance payments and revenue. You hear what they're saying? They couldn't keep up with the tests, but they kept pushing for more because it was the goose that lays the golden egg. Just keep the money coming. Keep the money coming. With the pandemic raging, the loose set of federal rules to police testing labs proved inadequate. Public health officials could do little more than express their exasperation as they struggled to contain the pandemic and the missteps. Says Marika DeCoeur, an epidemiologist with the Minnesota Department of Health. Ugh, they are exceptionally bad at this after discovering another reporting problem by GS Labs in April 2021. Stop right there, please. Pause. They discovered a reporting problem in April of 2021, and it was another one. It wasn't the first one. This was April 2021. But the backlog that I just mentioned was in December of 21. 8 months later, we had 28,000 tests backlog in December of 20, about 7 or 8 months ago. And 7 or 8 months prior to that, the Department of Health had been saying, ugh, they are exceptionally bad at this. Do you see the trend here? Nothing changed. The U.S. Centers for Medicare and Medicaid Services confirmed an ongoing investigation related to allegations of fraud, waste, and abuse with the GS Labs. The team of reporters that contributed to some of this information found this. Public health officials in Minnesota and other states had been grappling with problems caused by GS Labs for more than a year. Among their concerns, one, in April 2021, the company was delaying reporting 2,300 tests by up to a month, including 205 positive test results. In August, a few months later, GS Labs notified Minnesota and other states that it accepted so many tests that backlogged samples had to be stored in freezers for more than a month before they were processed. And then in December, 4 or 5 months later, company officials told Minnesota that a lab employee at GS Lab site in the St. Paul suburb of Maplewood caused 87 false positives. So now we have the article start with 28,000 tests that were backlogged, and of that, there were 10% almost that were positive, 1,400 people walking around not knowing they were positive, not knowing they were spreading the disease. And we find out that prior to that, there had been an employee who caused 87 false positives. So they'd been told that they had the disease and they didn't have the disease. Behind the scenes, however, the company was looking to maximize insurance payments by pushing customers to obtain all 3 types of COVID testing. So GS is out there pushing their sales reps, pushing their customers, get all 3 tests. What 3 tests are you talking about? Get the rapid test, get the PCR test, and the antibody test. Said Minnesota Department of Health epidemiologist Kathy Como-Sabetti in an email to colleagues in March of 2021. This is a year and a half ago, but this is a month in front of the April 2021. And when NPR wrote the article yesterday, you're talking almost a year and a half. This is curious price gouging, she said. The CDC had recommended in June of 2020, only 3-4 months into the pandemic, that antibody tests shouldn't be used to determine infection except when rapid or PCR tests aren't available. What was GS Labs charging? They charged as much as $340 for a rapid test. And get this, for a PCR test, $979. And they were recommending all three tests. So $340 plus $979. Now we're at, we're over $1,300. You throw in the antibody test. They didn't give the price here. Blue Cross and Blue Shield was one of the three insurers that sued GS Labs in federal court over those prices. But as if we haven't seen enough from GS Labs, they denied the allegations and they came back and are suing Minnesota-based Medica for refusing to pay for its tests. Quote, Medica's willful refusals to fully reimburse GS Labs constitutes deliberate disregard in addition to contempt for the rights and safety of its own insureds who have needed, currently need, and will need in the future the COVID-19 diagnostic testing GS Labs has provided. So here's GS Labs saying, get all three tests, never mind what the CDC says. Medica says, we're not paying those inflated bills. Blue Cross is suing them. And GS Labs just keeps going on. So what do we close with? At the Super Bowl in February, GS ran local ads in the Twin Cities where to get tested. This is waste, fraud, and abuse. This is why this physician from Oregon wrote this letter about our public medical response to COVID-19. Folks, there are a lot of pieces to the COVID-19 puzzle, to be sure. The old saying, follow the money, has a lot of validity. Here's what I have to say. The testing was a racket. It involved fraudulent activity made workable by intimidation. We were intimidated. We were told, test, test, test. People were able to enhance their corporate revenues by telling Americans, Minnesotans, test all three ways. The rapid test, the protein-based test, the PCR test, the antibody test. I have no idea how many tens of millions, probably hundreds of millions of dollars were wasted on our testing program. 28,000 tests backlogged. We as Minnesota citizens have every right to say, what in the devil is going on? Why did the Minnesota Department of Health not stop this fraudulent activity? I talked only today about testing and a physician from Oregon's concern that, if you will, public health responses were so misguided at times that it's no wonder people aren't buying what they're selling. I didn't talk about contact tracing. I didn't talk about a lot of other things that have to do with COVID. I just talked about one little piece, and that was testing. And this is something that we knew early on, that in regards to PCR testing, whether or not you got a positive or negative might be completely dependent upon how many times you would cycle. What was your threshold for cycling that test? Because if you cycled it a ton of times, you could probably guarantee at some point in time you get a positive. But if you stayed closer to 30, and I think Mayo Clinic had recommended that as well, we would probably have a more reliable test. I think we're coming out of this COVID pandemic. It is becoming endemic within our society. We're seeing that. We're seeing people that have done all the, quote, proper moves and still get the disease, and it appears that most of them by far are recovering. But we do have to hold people accountable. There have to be audits. Hundreds of millions of dollars have been wasted, and you've paid those dollars in by taxes. And our confidence mutually in various three-letter public health agencies has been compromised. And please, don't blame it on us. We're not conspiracy theorists. We're just saying this is wrong. Accountability by way of audits has got to take place. This is just about testing. And look at the fraud. Have a good weekend. Scott Jensen.